Hello again, and thank you for staying with us. We continue here. South Africa is facing a sinister and growing shadow, the illicit alcohol trade. Now, this is not a minor issue of informal enterprise, but a pervasive crisis silently eroding the nation's public health, its economic stability and social fabric. From toxic homemade brews and counterfeit products to legally manufactured but untaxed liquor, this underground market capitalizes on desperation and thrives in the cracks of poverty and inequality. Let's chat more about this with the Beer Association of South Africa's CEO, that's Charlene Louw. Charlene, good to have you on the program. So this latest data does show that nearly 1 in 5 alcoholic drinks sold in the country is indeed illicit. From your perspective at BASA, how did we get here? And what are the most alarming trends you've seen so far?
Thank you so much for having me. I do believe we got here due to enforcement that was inadequate over the years. We've obviously come out of a pandemic, and during the COVID period, we saw an escalation, if you will, of illicit alcohol. And this is obviously alcohol that is unregulated and, home brewed, if you will. And so over the years, due to that inadequate law enforcement, as well as what has transpired, coming out of COVID, we've seen an increase and a spike in the prevalence now of illicit alcohol. As you've rightly indicated, 1 in every 5 drinks in South Africa is essentially illicit alcohol.
The financial cost is eye-watering. Over 16 billion rand in excise duty losses last year alone. Charlene, but there's also the human toll that we speak of. What are some of the real-world consequences, if you will, that you've encountered or even heard of from communities who are affected by this illicit alcohol?
The study has shown us that, those that were part of that particular study, that they know 1 in 3 people that were surveyed know somebody that has died from consuming illicit alcohol. And so this is a public health crisis, if you will. And unfortunately, you do find that the drivers of this illicit alcohol is its affordability, its accessibility, and of course, as I've indicated, the lack of enforcement. And so, the reality of the matter is at this point, it's no longer something that is happening at a small scale. It is competing essentially with the legal market and eroding the legal market, and also influencing negatively on the ability of the legal market to sustain jobs and, of course, to contribute to the economy as it has been.
One of the articles I read highlight that these products are now even found in informal outlets. What does this tell us about enforcement on the ground? And are regulatory systems currently equipped to indeed detect and even act on this kind of infiltration?
You nailed it on the head, essentially. The level of enforcement is certainly not where it should be. I do have to commend, of course, those SAPS officials that do support the enforcement around this. But certainly, I think, as we know, the prevalence far exceeds the ability to enforce. And so, you do find that also the problems are in shall I say, the policy and regulatory framework, if I can put it that way, where often enough an illegal or illicit outlet is found to be retailing illicit alcohol. They pay an admission of guilt fine. And, what do you know? They basically reestablish themselves elsewhere. Alternatively, they just go back to trading until they get caught again. And so it becomes this vicious cycle. And I think what we do need to see outside of enforcement is a slight change in the legislation as well, making it a little bit harsher, if you will, from a penalty point of view against these illicit alcohol traders.
Let's get into that a bit more. BASA and your partners, you're also calling for stronger enforcement, like you're saying. But what specific actions would you like to see, especially from law enforcement and government agencies, to indeed shut down these networks?
Oh, absolutely. I mean, from our side, we do believe that this is a joint effort, right? the industry is playing its part in doing what it can in terms of one, having their ears on the ground and the intelligence to know exactly where this illicit alcohol is being produced. But we do need to partner more meaningfully, if you will, with government agencies to, I think at this point, like I indicated, it's a public health crisis. It really is, where the illicit alcohol is a cause of death. This is where we need to partner very strongly with the Department of Health and the likes of social services to create more education and awareness on the ground, so that we don't see any more deaths coming out of this particular problem.
Which segues quite nicely to this, because consumers, I'd imagine, are aware of the dangers of illicit alcohol, yet many still choose to buy this alcohol because of the price. What role does that then tell us about public perception or public education? Is there a role that this can play? And how is BASA working to indeed shift consumer behavior in this regard?
Yeah. So it's quite correct to say consumers, by and large, are aware, those that do consume illicit alcohol, particularly your unregulated produced alcohol. Like I indicated, the drivers are affordability. What we've found in the study is that this illicit alcohol is almost 40% cheaper than legal alcohol. And so with the type of economy that we find ourselves in, with many consumers very stretched, and it lends itself, if you will, to that environment where an illicit trade thrives within the context of where we find ourselves as an economy. At this point, we do need to continue to create education and awareness. I think I cannot overemphasize that to say, notwithstanding the fact that we have this situation of affordability of illicit alcohol, but they cannot be a situation where we want to see continued deaths from this type of alcohol production. And so ours is to continue the education and awareness, particularly on platforms such as this and others, and make sure that there is a clear understanding of the dangers and the impact essentially on human lives from this illicit alcohol.
With that said, and also as we conclude our conversation, if we don't act now, Charlene, what does the future look like for South Africa's alcohol industry and also for the safety of ordinary South Africans?
Yeah. It isn't a very good picture, if I can put it that way. I want to just contextualize it for your viewers to understand that this is an industry, particularly the beer industry, that contributes almost 100 billion towards the country's GDP. It employs almost 250,000 people. And so, you look at just from a tax revenue point of view, how much SARS collects from excise and taxes from this industry that enables government to do its role and job in terms of infrastructure, social services, and so forth. And so the minute you have this illicit trade eroding at that, it goes without saying that there will be negative effects, broadly speaking, on the economy, on jobs. And, what we've seen, for instance, because it is a case study for government to perhaps consider and reflect on, what has since happened to the tobacco industry, where it once did contribute so meaningfully to the economy, has been eroded so much so by the illicit tobacco trade that it is essentially something that we need to act now before we find ourselves in a situation where jobs are lost, lives are lost, and of course there's a knock-on effect on government's economic shall I say, recovery that this industry contributes to.
Charlene Louw, she's the CEO of Beer Association of South Africa. Thank you so much for your time and shining us a light on what is clearly not just an industry issue, but also a national crisis. Illicit alcohol seemingly robbing our economy, threatening lives, but also undermining trust in institutions. And the message is quite clear. If it will take collective action from policymakers to producers, consumers as well, to turn this tide. We do appreciate her leadership in the space, and we'll be watching quite closely to see how this situation evolves. Thank you so much to Charlene.